We're so glad you're joining us for this episode of our Ask a Professional video series on doula services. We created these conversations to help families better understand the different types of perinatal professionals they may meet during pregnancy, birth, and the postpartum period. There are so many supportive roles: doulas, nurses, lactation consultants, mental health providers, and more. And we want you to feel confident knowing what each one does and how they can help you. Our goal is simple: to give you clear, practical information so that you can make informed choices about the care and support that feels right for your family. Joining us today are Rachel Towers-Brooks and Alyssa Claxton from Open Heart Doula, a partner team who supports families through pregnancy, birth, and the postpartum period. They'll be answering some of the most common questions families have about doula care and explaining how a doula can support you through your birth journey.
Rachel Towers-Brooks. I'm a certified birth doula and childbirth educator. I work with Open Heart Doulas, helping moms in labor.
Hi, my name is Alyssa Claxton. I am a certified birth doula with Open Heart Doula. I have been doing this for about 16 years, supporting women in Knoxville.
Meeting with mamas, expecting families prenatally, getting to know what their birth wishes and desires are, getting them the right education they might need, being on call for usually 37 to whenever baby comes. That can be upwards of 42 weeks. Actual labor support looks like middle of the night phone calls, asking, hey, does this early sign and symptom, is this a normal thing? When contractions start and they're really regular, we do in-person continuous support. And one of the hugest benefits of a doula is we are through shift changes. So that continuous aspect is actually really important. We're with a mama through labor and birth and then immediate postpartum. And so we really protect the golden hour, which is the first hour after a baby is born. We establish family bonding, the first initial breastfeeding latch, kind of that newborn assessment time, just when the room gets quiet, really just protecting that space. And then postnatally, we usually do a follow-up home visit because lots of moms fall through the cracks and every provider is different. And so there's always going to be sometimes a short gap, but oftentimes even upwards of 6 weeks before that mom is seen again. So we make it a point to come and get on their couches and look at them eyeball to eyeball and make sure that they're actually surviving the postnatal season really well until they can get back into their OB. I think sometimes we can take complex medical words or processes and make them understandable in a way for families to understand what's actually happening. I like to say we're the bridge, right? We never want to be a wall. We're a bridge between the family and the provider. And usually it's a lack of communication that things tend to break down. It's allowing them to have space to actually process what's happening. It's allowing them to go, hey, wait a minute, do you need it explained again? Sometimes a simple miscommunication can create a lot of havoc in a birth. Anytime they want.
Yeah.
We have moms who literally pee on a stick and they call us before they call the doctor. And then we have moms who are rolling in 4 weeks before their estimated due date. Usually, the earlier someone will book our services, the more maximum benefit they're going to receive, because we do childbirth education. Sometimes we're going to find the holes of where their knowledge is. Different hospitals have different policies, so we're able to let them know what to expect. Knowledge is power, and so the more educated a family is, the less chances of trauma happening.
March of Dimes had just recently put out some research about maternity mortality rate in the United States. And unfortunately, Tennessee is at the highest of worst case scenarios. And some of they kind of come up with a list of things that they believe that will help in this situation. And one of those things was doula support for women. Just having someone who is listening and advocating and someone that they trust to make that connection if things aren't going the way that they expect for them to go. The most common phrase that we hear is, I just couldn't have done it without you. Feeling like they are empowered to make informed decisions along the way. We have a little bit lower of a C-section rate and less occurrence of postpartum depression and things like that. But that just really just comes from having somebody that is dedicated to supporting the laboring couple.
Every pregnancy and postpartum experience is unique, and accessing the right support can make a significant difference in health, safety, and overall well-being. We hope this discussion helps you feel more informed about your options and more confident in choosing the care team that aligns with your personal needs. Thank you for taking the time to learn with us.